So this is the hip joint. So let's have two different images here. So again, look at the bones. So this is the ilium, and this is the pubis, and this is ischium or ischium, and this is the femur, which is this is the head of the femur, and this is the neck of it. So this is a synovial joint, which again means what? This is hyaline cartilage at the end of each bone, and in the middle you have the synovial fluid that is located in the synovial cavity, which is coming from the synovial membrane, which is located inside the joint capsule. Okay. Another thing that you see is this one. So this is an intercapsular ligament, and this is called ligamentum teres, or ligament of head of femur. If you look at this image, again, go and look at the bones, the location of the bone, the bones. This is the acetabulum. Acetabulum is made of all three different bones. So the ilium is there, and the pubis and the ischium, all three of them are there. So this is made by all three bones. So this is a synovial joint, which means covered by articular cartilage, which is this one, and this is made of the hyaline cartilage, and is located in the lunate surface of acetabulum. Chapter 8, lunate surface of acetabulum. And this is the ligamentum teres, or ligament of the femoral head, that we saw around this one. So this is the same as this one. So this stabilizes the head of the femur, but there is also an artery and a vein is connected in this area. It's called fovea capitis. This is the area that is, so the head of the femur has its own blood supply. And also there is a ligament here. This is called transverse acetabular ligament, that is located above the acetabular notch. So if you want to know where is the acetabular notch, you have to go back and look at chapter 8, and you see that there is a acetabular notch, and there is a notch here in this area, and this ligament is connecting the hyaline cartilage and the acetabulum. You can also see this small part is difficult to see. So this is the fibrocartilage. This is called acetabular labrum. That gives stabilization for the joint. This is all the different ligaments that wraps around the hip joint. So look at the bones. This is the hip ilium, part of the hip bone, joint, I mean. So ilium is located superiorly, and this is the ischium located posteriorly, and this is part of the pubis located anteriorly and inferiorly, and this is the femur. So this ligament is connecting the pubis to the femur, and this is called the pubofemoral ligament. And this is ilium, is connecting ilium to the femur, and this is called the iliofemoral ligament. And this is the posterior view. How do I know this is posterior view? Is because of this. This is the ischial tuberosity. Okay, this is where when you sit, this part is connected or supporting your body above the surface of a chair or a seat or a bed or something. And again, look at the different bones. So this is the ilium, this is the ischium, and this is the femur. So this is iliofemoral. From ilium goes to the femur, and this is ischium or ischium. This is going from ischium to the femur. So ischiofemoral and iliofemoral.